So here's the secret that all dermatologists know about treating acne. The treatment that works best for a patient is the one that they'll use. Acne management is straightforward. It's not magical, and despite what you hear in commercials, there's no quick fix. If you find a product that seems to instantly make your skin better, it's probably either temporary or it may even actively be bad for your skin. But today, we're going to cover the things you can actually do to help your teen get their acne under control and keep it under control. I'm going to tell you what products you can get over the counter to create a skincare regimen for them that's both effective and affordable. So let's get started. Okay, just a quick disclaimer. In case we haven't met, I'm a pediatrician, not a dermatologist. But as such, we treat a lot of acne. If you were to bring your child to a dermatologist, they would start them on a treatment plan that's largely the same from one person to the next. It's standardized because it's evidence-based. We call that treatment plan a first-line treatment. If the response to that treatment isn't adequate, they would then add, you guessed it, second-line treatment. Like I said before, this is not magical, and the guidelines are all published and publicly available. In fact, I'll put a link in the description below if you want to read it. It's open access, so anyone can learn this information. What gets in the way of good skincare is not a dearth of information. It's the 5 billion skincare products that don't adhere to the principles of good skincare and muddy the waters for everyone. So I'm going to tell you what those first and second line treatment approaches are and what products contain those active ingredients so you can create a skincare regimen for yourself at home. So let's start with a clean slate. What is the foundation of a good skincare regimen? Here it is. Number 1, a gentle cleanser that allows you to remove oils and sunscreens and dirt and pollutants that you've accumulated during the day, but isn't overly harsh and doesn't strip your skin's natural barrier more than necessary. 2, a gentle moisturizer for nighttime. And 3, a moisturizer for the daytime that contains SPF. That's it. That's all you need. If your teen's skincare regimen includes an 18-step K-beauty process, or scrubs, or facial sprays, or God forbid those spinning facial brushes, please don't use those on your face if you have acne. Please don't use those on your face if you have a face. Anyway, so let's start by paring it all down. We want to simplify because we're about to start adding active ingredients. And we want to make sure that firstly, we're not aggravating the skin more than we need to, because that can lead to acne flares, and because certain skincare ingredients can interact with or sometimes inactivate other skincare ingredients. And if you don't know what you're doing, you could be wasting money on products that are then inactivating, or maybe making your acne worse, or maybe even both. So this is why the first thing we'd want your teen to do is to cut out all the extraneous stuff and just simplify everything. Let's make sure that their skin isn't already aggravated before we start adding active ingredients. This is why moisturizers are still included in this initial regimen. Because as much as teens think that putting a moisturizer on their oily, acne-prone skin will make it worse, it's actually the opposite that's true. Allowing your skin to lose moisture from the outer cuticle will not only make it prone to producing more oil, but also cause irritation and inflammation. Inflammation leads to skin cell proliferation that then plug up pores, which leads to acne. Depending on how complex or aggressive your teen's current skincare regimen is right now, you may want to have them use these 3 products for a few days or maybe even a few weeks, just to give their skin some time to calm down. So let's talk specifics. What products can you start with? Here are some of my favorite cleansers. The Cetaphil cleanser is classic. There's both a foaming cleanser and a cream cleanser, and they're both great. They're gentle, they get the job done, they're fantastic. I'm personally a big fan of oil cleansing. I think they're great for dissolving sunscreens and stuff, but they tend to make people with active acne really nervous, so we're gonna skip over that. Okay, another cleanser that's great is by Purpose. It comes in a liquid and a bar, which is convenient. A lot of teenage boys seem to prefer using a bar. I'm not sure why that is, but in case that's a thing for you, the bars exist. The next step is moisturizers for nighttime. One of my favorites is the CeraVe PM. It's gentle, it's non-comedogenic, it has niacinamide, which is great for helping to decrease redness. Also has hyaluronic acid, which is great for trapping moisture. Another one of my favorites is the CeraVe Skin Renewing Night Cream. It's also fantastic. It's a little more hydrating than the CeraVe PM. If your teen tends towards having more oily skin, they may prefer the CeraVe PM to the Skin Renewing Night Cream. Neutrogena also makes an oil-free moisturizer, which is another great option if your teen happens to have really oily skin. Okay, now I'm going to give you a bunch of options for moisturizers with SPF because there are just more factors to personalize when it comes to moisturizers with sunscreen. So I included options that are mineral only or contain only physical sunscreens. Those are the zinc and titanium dioxide. These are a little less likely to cause burning or stinging that people often get around their eyes with certain products. If you're someone with sensitive skin, these are less likely to cause problems because they work by sitting on top of the skin instead of being absorbed by the skin. I also included some combination and chemical-only options. These might be better options if you have a darker skin tone because they'll be less likely to leave that lavender cast on your skin. The CeraVe AM Facial Moisturizing Lotion SPF 30 is a combination sunscreen. It's very moisturizing. It's by CeraVe, but this might leave a cast if you have a deep skin tone because it is a combination sunscreen. It looks just like this, except instead of saying PM, it says AM. The CeraVe Sheer Tint SPF 30 is tinted, so it actually works reasonably well for a broader range of skin tones, despite being a mineral sunscreen. So you can use it around your eyes as well, and it shouldn't burn or sting. This is a great option for a lot of people. If you have a darker skin tone and sensitive skin, this one might be your best bet. Another one of my favorites is the Cetaphil Redness Relief. It's non-comedogenic, it's also tinted, which means it's a little easier to tolerate if you have a darker skin tone, despite being a mineral-only sunscreen. The Cetaphil Pro Oil-Absorbing Moisturizer SPF 30 is a chemical sunscreen, so it's better for darker skin tones and also good if you happen to have oily skin. The Elta MD Clear is a combination sunscreen that also has niacinamide in it, so it's also helpful for decreasing redness. It's one of the more expensive options, so that's something to keep in mind. The Eucerin Daily Hydration SPF 30 is technically a body moisturizer, but it's a chemical-only moisturizer. So if you have a dark skin tone, this is going to leave less of that lavender cast. Okay, so this is a place to start, but not a replacement for guidance from your pediatrician or dermatologist. In fact, before we move on to step 2, I'd like to take a second to look at some pictures with you because I don't want you to waste time working your way through this process if your teen is at risk for scarring. If your teen's acne looks like this, they have mostly white heads and maybe black heads, and they may be distributed over a wide surface area, but there aren't too many. Then this video is for you. This will almost certainly be all your child needs to control their acne. If your teen's skin looks more like this, they have some whiteheads, maybe a few more than the previous picture, and maybe the occasional red painful bump, then the complete regimen in this video may be adequate, especially if your teen's pretty good about adhering to the treatment. I would probably have them work through step 2 and start 3, and then maybe think about scheduling an appointment with their pediatrician to see if they needed additional treatment. If your teen's acne looks more like this, they have many whiteheads and a lot of red, swollen, tender bumps, and especially if they have anything that looks like this. This is permanent scarring from acne cysts and nodules. We don't have great ways of getting rid of this. The best thing we can do is to try to prevent it from happening in the first place. If your teen has skin that looks like any of these, call your pediatrician today or tomorrow morning to schedule an appointment and start steps 1, 2, and 3 at the same time. Your child's skin can handle these steps simultaneously. You can continue with these steps until you're able to get in to see your pediatrician, at which time they will probably add either a topical or an oral antibiotic and probably refer you to dermatology to consider isotretinoin, which is also called Accutane. So now that we've got that out of the way, let's add step 2. You and your teen have streamlined their skincare products. They've been on this simplified regimen for a week or 2. The second step is to start adding active ingredients. Often, the best place to start when it comes to adding medicated topicals is with benzoyl peroxide. Benzoyl peroxide is a fantastic treatment. It's antibacterial. It helps to clear up Propionibacterium acnes, that's now I guess called Cutibacterium acnes. It's also anti-inflammatory, which, like I said earlier, is one of the drivers of acne. It's also comedogenic, which means that it can break up skin and oil plugs that are blocking your pores that eventually lead to acne. So it kills bacteria, it decreases redness and inflammation, and it cleans out your pores. So this is a pretty impressive list, but it does come with a few downsides. Firstly, it can definitely give you some dryness and irritation, especially when you first start using it. Secondly, if it sits on fabrics for too long, it can bleach them. But if you use it as a wash instead of as a leave-on lotion, then that shouldn't be a problem. One of my favorite benzoyl peroxide containing products is the Panoxyl face wash. It comes in a 4% as well as a 10% wash. CeraVe also makes a cleanser that's called the Acne Foaming Cream Cleanser. It's a 4% benzoyl peroxide solution and also has niacinamide, which can help decrease redness. They call it a foaming cleanser. I haven't noticed any significant foaming. This is more expensive than the Panoxyl, but it's a little easier to tolerate if you have sensitive skin. Now, we call this a face wash, but it doesn't really have cleansing properties. It may be more accurate to call them a mask. For this reason, it makes sense to use your regular cleanser at night, since it's going to be capable of removing all the dirt and oil from the day, and then you can use the benzoyl peroxide wash in the morning when you don't really need the effect of the cleanser as much. The way to use it is to apply it to clean, damp skin and then leave it on for 1 to 3 minutes. When you first start using it, you may want to have your teen use it just like a cleanser. Put it on, rub it in circular motions to help it work it into your pores, and then rinse it off right away. As they acclimate to it over the first few weeks, they can then start to increase the treatment time. First 1 minute, then gradually increase to more like 2 or 3 minutes. You can maybe have them put it on, and then while they're waiting, they can brush their teeth or make their bed or contemplate the nature of existence. After you've rinsed it off, it will be extra important to apply a moisturizer with sunscreen because the benzoyl peroxide can be very drying. And like I said before, dry skin can actually make acne worse. So here are some pro tips on benzoyl peroxide. There's nothing stopping you from using these washes on other body parts. If you have acne on your chest or back or shoulders, what we call a cape-like distribution, you could get the 10% benzoyl peroxide because body acne can tolerate a slightly higher percentage. You just apply it the same way and leave it on like a mask while you're in the shower, and then rinse it off after a few minutes. But also, it's antibacterial, and so it may be helpful for you to use it on your armpits or your feet or to wash your butt. You can use it anywhere that you want to smell less. Actually, I wouldn't use it on your vulva. So this is what we would add first to your regimen, with gradually increasing treatment time over the first 1 to 4 weeks, depending on how sensitive your skin is. After they have started the benzoyl peroxide, they may start to notice improvement as early as 5 days, but more likely it'll take closer to 2 or 3 weeks before you notice any significant improvement. It will continue to get better and better up until about 12 weeks, when it will have reached its maximal effect. If you get to 8 weeks and still feel that it could be better, then we'd have you move on to the next step. Step 3 would probably be to add a retinoid. Retinoids include tretinoin, which is also called Retin-A or Renova, and tazarotene, which is also called Tazorac, or adapalene, also called Differin, which is actually available here in the US. Retinoids work by thinning the top layer of the skin. They do this by changing the rate of skin cell proliferation, which is how fast the skin cells reproduce, and keratinization, which is how hard and scaly the top layer is. The more keratinized the skin cells are, the more easily they can fill up and clog up pores. So retinoids kind of serve to peel the skin and unclog pores. And they also actually retrain the skin cells to behave the way that they're supposed to, instead of going crazy like they do when you have acne. When you start using a retinoid, you can also get quite a bit of redness and irritation, and sometimes even peeling, but there are ways to decrease those side effects, and the way you use a retinoid can definitely make a difference. Firstly, I'd probably have them apply it at night, after they've washed their face, after they've applied their moisturizer, and after it's had a minute or two to dry. That layer of moisturizer will help to slow the absorption of the retinoid so it causes less irritation. Secondly, you should be only using a tiny dab, less than a pea-sized amount. It should be such a small volume that you may actually have trouble getting it to spread across the surface area. We want you to use such a tiny dab that you may need to mix it with an equal-sized dab of moisturizer just to get it to cover the surface area. A lot of teens want their acne to go away as quickly as possible, and so they work under the assumption that if some is good, then more is better. That doesn't apply here. Here's how we want you to apply it. Take the tiny blob and dab it to the sections of your face, and then spread it from there. Okay, so they've applied the retinoid and it's starting to burn. For some people, they can't even handle using a retinoid as a leave-on product when they're first starting it. For those people, we'd want you to do the same thing. Apply to clean skin after moisturizing, leave it on for 10 minutes, and then rinse it off. Treat it like a mask. And then you can gradually increase the treatment time until you're able to use it all night. For most people, when they first start a retinoid, we'd have them use it just every other night. And then after a week or two, they can increase it to every night if they're tolerating it. So you're probably wondering, how long will it take to start to see results? And the answer to this question also relates to one of the most feared side effects of retinoids that people refer to as the purge. So because of the way retinoids work, they basically take everything that's lying dormant in your pores and being gross but not doing anything, and they bring it all to the surface. And this means that your pores are cleaner, but also that all that stuff that wasn't doing anything now has a chance to become acne. And a lot of it can and does become acne. This means that when you start using a retinoid, a lot of people will notice that their acne gets worse, at least initially, before it starts to get better. For a lot of people, this phase can last 2 to 4 weeks. This also means that once you start using a retinoid, you really need to be pretty consistent about it. Because if you go on vacation or just stop using it for a bit, or you run out, you could set yourself up to have another purge when you start it up again. And ain't nobody got time for that. And this brings up an important point. In order for this to work, your teenager has to participate, which means you need buy-in. If they don't care or are actively resistant, then that's a problem that we really need to address first. But getting your teenager to care about their hygiene or their acne or their future health, that's a topic for another day. We will do that one, just not today. So there's a lot more to potentially add to this process, and this is obviously not the only way to set up a good skincare regimen for acne, but it is an option you can trust because it's supported by evidence. But good luck with all of this, and as always, remember that the best way to take care of your kids is to take care of yourself. Thanks for joining me. So if you tend towards having It's, dude, please don't use those on your face if you have a